I hope you all have a little bit of energy left for the conversation. And part of the challenge of going last is trying to make sure you have some new points and perspectives to bring. And I hope that you gain that from what I have to say. It's a real honor to be here talking about an issue that's so important to our community. Thank you to all the planners for this opportunity to just talk with you. And as I prepare, it allows me to reflect. And in that reflection, I learn more about how I'm approaching the work and where we can improve on our strategies. My remarks are mostly focused on the journey that Pillsbury United Communities has been on over the last several years. That we jumped into a process to figure out how we can address disparities in a deeper way. I have a staff person here. I saw him. I said, well, let me make this good. So a wall is over there. Before I talk about the organization, let me just say a bit about myself. I was raised in North Minneapolis. I'm 5th generation there. My dad is from the South Side, where it's 3rd generation. I still live in North Minneapolis, where I'm raising 4 sons and a daughter. My parents and my mother, in particular, raised my sister and I with a strong belief that we give back to community and we make it healthy by staying there and committing to it. As a young person growing up in North Minneapolis, I remember how it was described. And I remember the conversations around me, about me, without me. And it impacted me deeply as I lived with my parents, both of them. We didn't have negative things happening in my family, the normal stuff, right? Like arguing over the toilet seat or the top on the toothpaste, just normal stuff. And I remember asking one of my aunts one time, I didn't know that because I lived here, it means that I have a rough life ahead of me. Is that true? Like, what can I do to make my life better? And it was this old honey comment about, the stuff that they would say. But that stuck with me and still sticks with me. That there's a narrative that happens in community about people that in its very essence is not safe. It's creating the foundation for decision making and unhealthy choices that shouldn't have to happen just because we disregard them because of a zip code or because they're living in poverty. Bill Strickland, who I have a great respect for, said, the only thing wrong with poor people is they have no money. And yet we know it's more complicated than that. The issue of safety and health in community is evolving. I wrote our strategic framework in 2014. We began to implement it in 2015. And the issues that we've been faced with in the last 12 to 18 months weren't even really, they were there, but not like this. The idea of, can you go into a place without someone making fun of you, talking about you, attacking you, whether or not it's real or perceived, it's real in community. And we have to, I think, together figure out strategies, but most importantly, how to be in relationship with each other. Because that is the foundation in which good work happens and where change occurs. I thought about a couple of things that were said about listening and including community. And, we share some similar things here. And there's times where I'm sitting at tables where I'm talking with, big titled people about what we need to do in the community. And sometimes I think they must just see my title or something, right? Like, I actually do have some context here. And so I think about that to say that sometimes when I'm at tables and I'm the CEO of an organization and I feel like my lived experience is not valued the same way at the table, it only causes me to think about how am I not going to do that when I'm with other people in the community. That when you don't feel valued, when you feel despair, when you feel underestimated, when you have a negative narrative, when you see that reflected, you can't feel safe or healthy. Part of the challenge of this work, I think, is to be self-reflective and understand why you're in this work. Understand, are you trying to fix the people? Or are you there to contribute to improve their lives with them together? So regardless of where you enter into the conversation, your value, how you value the person that you are working with and trying to impact, will allow you to be successful in ways that you won't imagine. Pillsbury United Communities was founded in the late 1800s as part of the Settlement House movement, where its founders placed houses or neighborhood centers to support immigrants as they settled into the New World. With a strong belief that in order for people to be successful, they must first feel safe, have a place to meet their neighbors, and have an opportunity to create programs together to meet the needs that they were facing. Today, Pillsbury still operates very much at that core, operating 5 neighborhood centers across Minneapolis, the social enterprises that we're mentioning, and offering a range of programs and services. In 2015, we began to implement our new strategic framework focused on increasing our capacity to do our work. It was really developed from us asking the question, with the widening and persisting disparities in health, education, and employment, were we doing enough? That it's very easy to focus on the programs and the activities and not question whether or not that is actually the right strategy for us to be doing, and is it enough, and should we go deeper, or should we rethink it, retool it, reframe it? And what we realized is that, in fact, we could do more. That in order to do that, we needed to challenge ourselves, we needed to disrupt our current way of doing business, we needed to challenge convention and push beyond our organizational comfort zone. Our plan acknowledged the complexity of poverty, systemic barriers, the legacy of injustice. We focused on the how we wanted to do the work, the how, the why. That for us to make a sustainable difference in community, that in fact we needed to be more impactful outside of our doors than inside. What do I mean by that? That our organization really did its work depending on those folks that choose to come in our doors, which is a lot. But that we realize that if health and safety and there's challenges in community, that we actually had to go into community in a much different way. That we can know that those core programs offer a safety net, but for the people that really, really, really need it, they most likely weren't going to come in those doors. We knew that even for the folks that did come in our doors, if they were unable to navigate systems, if the policies remained the same, if they were continued to be marginalized, to lack the opportunity to just get a fresh start, that no matter how well we prepared them, they were still going to encounter barriers to their own success. So what must we do? And we were just rolling along, and I encountered this situation, and I'll tell you what it is. I decided that I was going to lead our youth team for a year because they were talking about how challenging the work had gotten. And we had a college preparatory program, and I looked at the goals of the program, and I thought, this is what we're doing, that we're giving kids points for attendance and It just felt so minimal, right? And what we're trying to do is get them to college, so we need to make sure that they have the right GPA, that they have their college essays done, that they're passing English, they're passing math, and that we needed to align what we were preparing them for with the requirements of where we wanted them to go. So that sounds so simple. I go in the meeting with my freshly designed idea, rejected immediately, right, by the team. And one woman in particular said, "I don't think this is fair. I don't think they shouldn't get a point until they get to a 2.0 GPA. That's just not fair. That's not inspiring to them." And I said, "Oh, wait, I made some assumptions in this plan. I made the assumption that because 70% or more of our staff are people of color that live in the neighborhoods that we work in, that we understood the challenges more broadly, more systemically, that were happening in our communities. What I failed to recognize is that proximity does matter for many, many, many reasons. I also needed to understand that because of proximity, we often couldn't see what was right there. That in order for us to have perspective, we needed to bring other people in to challenge this, that we needed to do some self-education ourselves. I tell people, I'm African American, right? The staff is 70% people of color. I spend more time thinking about how do I make sure that our agency is inclusive, and how do we make sure that we're moving forward in my organization that I'm running on these issues of equity. We know how the neighborhoods line up. We operate Brian Coyle Center. It's mostly East African. It's East African. We operate Wade House and Phillips, largely Latino, Native American. Right? You go over to the north side, it's African American. They're not in the same center. They may not be in the same neighborhoods. If they're in the same neighborhoods, are we talking? Are we building a safe and healthy community that everyone can function in? I'm not sure we are if we're not being more intentional about how do we break down those silos and bring people together so that they can be part of solutions in ways that we did when we were founded as an organization, where you come together, understanding each other's issues. And we're in an amazing time where issues are being surfaced, and we can't say whose issue is most important because they're all important. Right? By raising up one issue as the way, and that's the truth, the light, and everything else, it's disregarding someone else's place and where they are and how they're feeling. Martin Luther King once said, when we look at the modern man, or I'll add woman, we have to face the fact that they suffer from a kind of poverty of the spirit, which stands in glaring contrast with scientific and technological abundance. His words are striking to me, and my interpretation is that, and my expansion on it is that when a community is aware that there's an abundance of resources and technical means to make their lives easier, yet it's not available to them, it creates a kind of poverty of the spirit. That in order for communities to be well and to address the condition in which people are born, grow, live, work, and age, social determinants, and the system shaping those conditions, we must address the poverty of the spirit. Pillsbury United Communities envisions that all individuals and families are well and living in thriving communities. And it was imperative, it's essential, and I don't even know if we're there yet, but I know that part of the work is to ensure that in our organization, in our work, that there's a collective belief that that can happen, that it's possible, that we need to see communities for what is possible, that we need to know that it can be true so we can work towards that. In short, we've been on a journey of what ifs, and exploration that led us to some interesting solutions. One of which I'll share with you about our journey to open a grocery store in North Minneapolis. So in North Minneapolis, the life expectancy on average is 7 years shorter than any other part of the city. You can go 2 miles in any direction and their lives would be extended. My life would be extended because I live there. My kids' lives would be extended because they live there. Why is that? Because 2 miles away, we can see what it looks like to be healthier. Yet we're not taking the urgent actions to make it so. National data shows that in low-income zip codes, there's 30% more convenience stores than in middle-income neighborhoods. North Minneapolis has 33. They lack access to basic amenities that are taken for granted, like a grocery store. North Minneapolis has one full-service grocery store for 67,000 people. Woodbury has 6 or 9 or something similar size. It's a well-researched fact that grocery stores in underserved communities create jobs and help revitalize communities, and it improves health. We did not sit in a room and say, what should we do? And then a staff didn't say, we should build a grocery store. It didn't happen like that. What happened is that we had a small grant to look at underutilization of the WIC program. And the state was working with us, and we said, well, we can't do that without talking to the people that are on WIC. So I had staff go shopping and go through the process and sit down and talk with and interact with. And we discovered some things that were not the things that the state thought and that the people around the table thought. They thought, well, maybe they just don't realize the health advantages of the WIC program. And if they only did it till 6, their kids would have opportunity for these fruits and vegetables that would make them healthier, and then they'd be able to be more attentive in school. The residents were saying, I don't feel respected. I feel demeaned in the process. I have to take too much time off of work to go get a doctor's appointment, my WIC voucher, go get groceries. I'm losing wages. I get to the grocery store, my point of sale experience is not good, whether it's from the people in the line or because I grabbed the wrong box of cereal, the wrong ounces, so it doesn't qualify, and I've got babies in my basket. I got to get out of line and do it over again. I don't want to do that. That's a different problem for us to solve. So we started thinking, is it really, if we're really trying to impact health, should we be just addressing the underutilization of WIC? I don't know. So we thought, well, we learned a lot, so maybe we should do WIC to go so that we can continue to have these conversations so we can build from there. So we got some refrigerated vehicles that we were going to retrofit that were given to us. But we couldn't do it because the state said no because there was milk fraud in the 90s. And so essentially I got to, you know what, we're going to open up our own damn store. How about that? And that's essentially how the conversation went. And so this is what North Market looks like right now. Our timeline is to open in November of this year. You know, just like we're steadily getting there. I really believe it's gonna be right. But before I tell you all, well, no, I'll just tell you. So the grocery store is 16,000 square foot grocery retail. There's about 5,000 square foot health services, dietitian, nutritionist, clinic, pharmacy. We decided to put a university-inspired classroom. I hope it looks like this, maybe that little section right there because we don't have a lot of space. But I thought, you know, we need our community to understand health. We need to pipeline people into health-related careers. We can't just bring groceries, let's bring the opportunity for them to advance themselves in other ways which contribute to their overall health, sustainability of their family and the community. Let's do that. We also have community health or community room for events, for product launches, where we can help entrepreneurs in the community put their products on our shelves. We have cooking classes, a number of other things that will be in that space. On this journey has been General Mills, who brought data analytics support and marketing. Knock Inc., who's been working on this for 2.5 years with us, pro bono. Cargill has been phenomenal. The university, we've done some partnership here on evaluation and what do we want to measure. North Memorial is going to operate the clinic. We have a 10-year agreement with them. Oppidan, who builds grocery stores across the country, came in. They helped us write our business plan, pro bono. And I could name 20 other people that I didn't know when we started talking about the underutilization of WIC. What's quite remarkable and amazing is how we had built the culture for us to evolve our thinking and our strategy. Because if you are so committed that what you want to do is right, you might actually miss the right thing to do. That this project is $6.3 million. In the scheme of things, it's not that much money. But it's really amazing how long it's taking to get there, right? It's short, but it's long. Because if we want to address issues of equity, it's not equitable to have one grocery store for 67,000 people. We're one of the top 10 food deserts in the country, or food swamps, whatever your choice, it's still bad, right? We're still at the top. And it's contributing. And you know how else it contributes? When kids and families walk around and they don't see assets in their community, and they feel like they're undeserving somehow because they're not there. That for us to be able to turn a parcel of land that has been vacant into something that is vibrant. We often say our 6th community center, a place that you can go to meet your neighbor. Think about going to places in your neighborhood where you run into people, you talk to their kids, you have an opportunity to see things and do things. How do you do that in a neighborhood like North Minneapolis, or a neighborhood where there's nowhere to go, to gather? Because sometimes we think about health from all these interventions and we forget that there are just some basic things that people should have for them to be able to live fully healthy lives. So in closing, I want to share the points of what I've said. That you have to believe in people as much as you believe in the intervention. That people feel safe when they are honored, respected, and included. And that making assumptions will lead you astray. That if you don't have proximity to the issue, you need to figure out how to get proximate to it. And that we all have a role in improving health outcomes, and that integrated solutions make a lot of sense in the communities where they are with their voices at the table as an equal partner. So I certainly appreciate your attention. I appreciate your commitment to improving outcomes for our families, to building the kind of community that we can be proud of. Now more than ever, there's a different amount of courage that is needed in this work. We really have to be bolder and think bigger. That whatever you're thinking now, just like take it up, right? That fleeting idea that you had that you said, well, I don't know if I can do it, right? If we would have started at the table with the staff saying, let's open a grocery store, guaranteed I would have said no, right? Guaranteed. The state that said no to the mobile WIC is our partner over here looking to see whether we can pilot a new way of doing it in the grocery store. What a transformation between no to I'm at the table and I'm willing to assist in a new way of doing things. Because no just means no, I'm that. I didn't draw the conclusion that meant no on everything, right? And so sometimes we get discouraged in this work. There's a lot of stuff hitting us. I wonder if we're all safe and healthy and well in this work. And so, when you're feeling all this bigness and you're told no, I just look at it as that thing is moving out your way for something more significant, and that you have to be committed to what you want to do so that you are present when those opportunities present themselves to you. Thank you very much, and I look forward to the questions.